Good day, everyone. My report is all about the concerns of the profession. Topic outline: test user qualifications, testing people with disabilities, life or death psychological assessment, and next, computerized test administration, scoring, and interpretation. And last is the guidelines with respect to certain populations. The intended learning outcomes. By the end of the discussion, you will be able to first have knowledge about the history of APA, identify the test user's qualification, and last is to you can identify guidelines for professionals in the field. Let's move on to the history. As early as 1895, the American Psychological Association, or the APA, in its infancy, formed its first committee on mental measurement. So the committee was charged with investigating various aspects of the relatively new practice of testing. Another APA committee on measurement was formed in 1960. So it was formed to further study various testing related issues and problems. In 1916 and again in 1921, symposia dealing with various issues surrounding the expanding uses of tests were sponsored. In 1954, the APA published its technical recommendations for psychological tests and diagnostic tests. So, a document that set forth testing standards and technical recommendations. The following year, another professional organization, the the National Educational Association, working in collaboration with the National Council on Measurement Used in Education, so it is now known as the National Council on Measurement, published its technical recommendations for achievement tests. So, collaboration between these professional organizations led to the development of rather detailed testing standards and guidelines that would be periodically updated in future years. So expressions of concern about the quality of the tests being administered could also be found in the work of several professionals acting independently. Anticipating the present-day standards, Roach of 1925, a measurement specialist, proposed a number of standards for tests and guidelines for test development. He also wrote of the urgent need for a fact-finding organization which will undertake impartial, experimental, and statistical evaluations of tests. Let's move on to test user qualification. Should just anyone be allowed to purchase and use psychological test materials? If not, then who should be permitted to use psychological tests? So as early as 1950, an APA Committee on Ethical Standards for Psychology published a report called Ethical Standards for the Distribution of Psychological Tests and Diagnostic Tests or Diagnostic Aids. So, this report defined three levels of tests in terms of the degree to which the tests use required knowledge of testing and psychology. We have three levels. So level A, tests or aids that can adequately be administered, scored, and interpreted with the aid of the manual and general orientation to the kind of institution or organization in which one is working. So, for instance, achievement or proficiency yun siya. Then, level B, we have tests or aids that require some technical knowledge of test construction and use and of supporting psychological and educational fields such as statistics, individual differences, psychology of adjustment, and personal psychology and guidance. So example of this is aptitude tests and adjustment inventories applicable to normal populations. Then level C, tests and aids that require substantial understanding of testing and supporting psychological fields together with supervised experience in the use of these devices. So for instance, projective test or individual mental tests ang included doon. So the report included descriptions of the general levels of training corresponding to each of the 3 levels of tests. So although many test publishers continue to use this 3-level classification, some also do not. In general, professional standards promulgated by professional organizations state that psychological tests should be used only by qualified persons. So furthermore, there is an ethical mandate to take reasonable steps to prevent the misuse of the tests and the information they provide. Next is the obligations of professionals to test takers are set forth in a document called the Code of Fair Testing Practices in Education. So in here we have 4 areas. So the document was prepared by the Joint Committee of Testing Practices. This document presents standards for educational test developers in 4 areas. So the 4 areas are developing selecting tests, second, interpreting scores, next is striving for fairness, and last is informing test takers. In developing or selecting tests, test developers should provide the information that the users need to select appropriate tests. And users should select tests that meet the purpose for which they are to be used and that are appropriate for the intended test taking populations. In interpreting scores, test developers should help users interpreting scores correctly. Then, the users should interpret scores correctly. In striving for fairness, test developers should strive to make tests that are as fair as possible for test takers of different races, gender, ethnic backgrounds, or different handicapping conditions. So test users should select tests that have been developed in ways that attempt to make them as fair as possible for test takers of different races, gender, ethnic backgrounds, or different handicapping conditions. So, in number 4, informing test takers. Under some circumstances, test developers have direct communication with test takers. So, under other circumstances, test users communicate directly with the test takers. So beyond promoting high standards in testing and assessment among professionals, APA has initiated or assisted in litigation to limit the use of psychological tests to qualified personnel. Since 1987, a psychologist licensing law designed to serve as a model for state legislators has been available from APA. So the law contains no definition of psychological testing. In the interest of public, the profession of psychology and other professions that employ psychological tests it may now be time for that model legislation to be rewritten. So the terms such as psychological testing and psychological assessment clearly defined and differentiated. So people who are not considered professionals by society may be qualified to use psychological tests or psychological testers. However, these same people may not be qualified to engage in psychological assessment. So what is the reason? So as we argued in chapter 1, psychological assessment requires certain skills, talents, expertise, and training in psychology and measurement over and above that required to engage in psychological testing. So in the past, psychologists have been lax in differentiating psychological testing from psychological assessment. So, however, continued laxity may prove to be costly indulgence given current legislative and judicial trends. Um, Challenges analogs to those concerning test takers from linguistic and cultural minorities are present when testing people with disabling conditions. Specifically, these challenges may include, first, transforming the test into a form that can be taken by the test taker. Second, transforming the responses of the test taker so that they are scorable. And last, meaningfully interpreting the test data. The nature of the transformation of the test into a form ready for administration to the individual with a disabling condition will, of course, depend on the nature of the disability. Then, so, some test stimuli do not translate easily. So, for example, if a critical aspect of a test item contains artwork to be analyzed, there may be no meaningful way to translate this item for use with test takers who are blind. So with respect to any test converted for use with a population for which the test was not originally intended, choices must inevitably be made regarding exactly how the test materials will be modified, what standards of evaluation will be applied, and how the results will be interpreted. So another complex issue, so this one, ethically charged, has to do with request by a terminally ill individual for assistance in quickening the process of dying. So in Oregon, the first state to enact death with dignity legislation, a request for assistance in dying may be granted only contingent on the findings of a psychological evaluation. Life or death literally hangs in the balance of such assessment. Let's move on to life or death psychological assessment. After testing people with disabilities, this is the next part, the life or death psychological assessment. So Oregon's Death with Dignity Act, or the ODA, provides that a patient with a medical condition thought to give that patient 6 months or less to live may end his or her own life by voluntarily requesting a lethal dose of medication. So the law requires that two physicians corroborate the terminal diagnosis and stipulates that either may request a psychological evaluation of the patient by a state licensed psychologist or psychiatrist in order to ensure that the patient is competent to make the life-ending decision and to rule out impaired judgment due to psychiatric disorder. Assistance in dying will be denied to persons suffering from a psychiatric or psychological disorder or depression causing impaired judgment. This is according to ODA or the ODDA of 1997. So since 1997, similar legislation has been enacted in other states like California, Montana, New York, no, it's not New York, New Mexico, Vermont, and Washington. And a number of other states are actively considering such death with dignity. So otherwise, death with dignity is otherwise known as physician aid in dying. Although our focus here is on the ODA, as it affects psychological assessors who are called upon to make life and death evaluations, many of the complex issues surrounding such legislation are the same or similar in other jurisdictions. Professional associations such as the American Psychological Association and the American Psychiatric Association have long promulgated codes of ethics requiring the prevention of suicide. We have assessment process or the ODDA assessment process. So first assessment process is the review of records and case history. So with the patient consent, the assessors will gather records from all relevant sources, including medical and mental health records. So the goal of this assessment process is to understand the patient's current functioning in the context of many factors, ranging from the current medical condition and prognosis to the effects of medication and substance use. Next is consultation with treating professionals. With the patient's consent, the assessor may consult with the patient's physician and other professional involved in the case. So the reason is to better understand the patient's current functioning and current situation. Third is the patient interviews. Sensitive but thorough interviews with the patient will explore the reasons for the aid in dying request, including the pressures and values motivating the request. So other areas to explore include the patient's understanding of his or her medical condition, the prognosis, and the treatment alternatives. B, the patient's experience of physical pain, limitations or functioning, and changes over time in cognitive, emotional, and perceptual functioning, and the patient's characterization of his or her quality of life, including exploration of relative factors including personal identity, role functioning, and self-esteem. And last is the external pressures on the patient, such as personal or familiar financial inability to pay for continued treatment. Let's move on to fourth assessment process. Interviews with family members and significant others. So with the permission of the patient, separate interviews should be conducted with the patient's family and significant others. So one objective is to explore from the perspective how the patient has adjusted in the past to adversity and how the patient has changed and adjusted to his or her current situation. Fifth is the assessment of competence. So this aspect of the assessment is complicated and only the barest of guidelines can be presented here. So in general, the assessor seeks to understand the patient's reasoning and decision-making process, so including all information relevant to the decision and its consequences. Some formal tests of competency are available, but the clinical and legal applicability of such tests to an ODA assessment has yet to be established. Sixth is the assessment of psychopathology. So, to what extent is the decision to end one's life a function of pathological depression, anxiety, dementia, delirium, psychosis, or some other pathological condition? So, this is the question the assessor addresses using not only interviews but formal tests. So example of many possible instruments the assessor might employ include intelligence tests, personality tests, neuropsychological tests, symptom checklist, and depression and anxiety scales. So refer to the appendix in Fahrenkopf and Bryan for complete list of these tests. Then number 7, reporting findings and recommendations. So findings including those related to the patient's mental status and competence, family support and pressures, and anything else relevant to the patient's aid in dying request should be reported. So if treatable conditions were found, treatment recommendations relevant to those conditions may be made. Non-treatment types of recommendations may include recommendations for legal advice, estate planning, or other resources. So in Oregon, a psychiatric or psychological consultant's compliance form with the consultant's recommendations should be completed and sent to the Oregon Health Division. So the next topic is the computerized test administration, scoring, and interpretation. So computer-assisted psychological assessment, or the CAPA, has become more the norm than the exception. So for assessment professionals, some major issues with regard to CAPA are as follows. So the first major issue is the access to test administration, scoring, and interpretation software. Next is comparability of pencil and paper and computerized versions of tests. Third, the value of computerized test interpretations. And last, the unprofessional, unregulated psychological testing online. So, the access to test administration, scoring, and interpretation software. So in here, despite purchase restrictions on software and technological safeguards to guard against unauthorized copying, software may still be copied. So unlike test kits, which may contain manipulatable objects, manuals, and other tangible items, a computer-administered test may be easily copied and duplicated. So the next one major issue is comparability of pencil and paper and computerized versions of tests. So many tests once available only in a paper and pencil format are now available in computerized form as well. So in many instances, the comparability of the traditional and the computerized forms of the test has not been researched or has only insufficiently been researched. So in the value of computerized test interpretations, so many tests available for computerized administration also come with computerized scoring and interpretation procedures. So thousands of words and spewed out every day in the form of test interpretation results, but the value of these words are in many cases are questionable. Then last major issue is the unprofessional or unregulated psychological testing online. So a growing number of internet sites purport to provide, usually for a fee, online psychological tests, yet most of the tests offered would not meet a psychology standards. Assessment professionals wonder about the long-term effect of the of these largely unprofessional and unregulated psychological testing sites. So the last topic is the guidelines with respect to certain populations. So from time to time, the American Psychological Association, or the APA, has published special guidelines for professionals who have occasion to assess, treat, conduct research with, or otherwise consult with members of certain populations. So in general, the guidelines are designed to assist professionals in providing informed and developmentally appropriate services. So note that there exists a distinction between APA guidelines and standards. Although standards must be followed by all psychologists, guidelines are more aspirational in nature. So in late 2015, for example, APA published its guidelines for psychological practice with transgender and gender nonconforming, or the TGNC people. So the lists and discusses 16 guidelines. So to get a sense of what these guidelines say, the first guideline is psychologists understand that gender is a non-binary construct that allows for a range of gender identities, and that a person's gender identity may not align with the sex assigned at birth. So the last guideline in here is the guideline 16, which states that psychologists seek to prepare trainees in psychology to work competently with the TGNC people. That's it. Thank you.